All right, today we're diving into something really important, the intricate link between anxiety and addiction. When someone's dealing with both at the same time, it's actually got a name. It's called a dual diagnosis. And really, getting a handle on this connection, that's the first major step on the road to recovery.
So you got to ask, right? Why do these two things, anxiety and addiction, show up together so often? It's definitely not just a coincidence. There's this really powerful psychological engine at work that connects them, and it creates this cycle that can feel, well, almost impossible to get out of.
And that question is the perfect lead in to our first big topic, what we call the vicious cycle. We're going to break down the core mechanism that really traps people, and it all comes down to this idea of self-medication. So we mentioned it a second ago, but let's officially define it. This overlap has a clinical term, dual diagnosis. It's pretty straightforward. It just means a person is grappling with both a substance addiction and a psychiatric condition, like anxiety, simultaneously. And as you can imagine, tackling two things at once adds a whole new layer of complexity to the recovery process. This is where it gets really interesting. The term doctors use is self-medicating. And think about what that means. It's someone trying to use a substance, whether it's alcohol or something else, to basically quiet down the noise of their anxiety. The problem is, it works, but only for a little while. That temporary relief is incredibly powerful, and that's exactly why the brain wants to do it again and again. And here's how that trap snaps shut. It's a four-step spiral. First, you've got the anxiety, the fear, the worry. So step 2, you reach for a substance for that quick relief. But then, step 3 hits. The substance wears off. And that anxiety, it doesn't just come back. It often comes back stronger, sometimes with withdrawal symptoms piled on top. And that, of course, leads right to step 4, using again. It's a brutal downward spiral that really cements the addiction.
Okay, so we see the cycle, we get how it works, but how does a clinician even begin to untangle it? Well, that takes us to the next crucial piece of the puzzle, the assessment. Because before you can treat it, you have to figure out the why and the how. The causality is everything.
And it all boils down to this one single, absolutely critical question. Which came first? Was it the anxiety or was it the addiction? Now, it sounds like a simple chicken or the egg thing, right? But the answer completely changes the game plan for treatment. You have to know, is the substance use a response to anxiety, or is the anxiety a direct result of the substance use? So there are really two main roads this can go down. Pathway 1 is when the anxiety is the starting point. A person already has an anxiety disorder, and they start self-medicating to cope, which eventually leads to addiction. But pathway 2 is the complete opposite. Here, the substance abuse itself, think stimulants like cocaine or amphetamines, actually creates the anxiety. The drug's effect on the brain chemistry directly triggers those psychiatric symptoms.
And this is why figuring out which pathway it is so crucial. Think about it. If the anxiety is just a byproduct of the addiction, then focusing on getting the person sober is often enough. Stop the substance and the anxiety symptoms fade away. But if the anxiety was there first, you can't just treat the addiction. You have to treat both, or the person will likely relapse to self-medicate again. You have to get to the root of the problem.
All right, so once we figured out what's driving what's next? What does treatment actually look like? This brings us to what I like to call the toolkit for recovery. We're going to look at some proven, evidence-based therapies that are designed specifically to handle a dual diagnosis.
We're going to break this down into 3 main strategies. First up, you have cognitive behavioral therapy, or CBT for short. That one's all about our thoughts. Then we've got a set of behavioral techniques, which are more about our actions. And finally, something that's incredibly important, group therapy and counseling.
Let's dive into CBT first. The whole idea behind cognitive behavioral therapy is that our thoughts, our feelings, and our actions are all tangled up together. It operates on this really powerful principle. A lot of our anxiety comes from, well, unhelpful or frankly distorted ways of thinking. So the goal of CBT is to become a detective of your own mind, to find those negative thought patterns, and then to challenge them. This chart is a fantastic way to see it in action. On the left, you've got what are called automatic thoughts. These are the things that just pop into your head, like, I always mess things up, or things are out of control. But the really deep work is on the right side, the maladaptive schemas. These are the core beliefs that fuel those automatic thoughts. Things like, I must be perfect to be accepted, or I am unlovable. CBT is all about drawing a line between the two so you can start to question those deep-seated, often untrue beliefs.
Okay, so that's the thinking part. Next up are the behavioral techniques, where CBT zooms in on your thoughts. These therapies zero in directly on your actions. They use proven learning principles to basically help you unlearn the bad habits and replace them with new, healthier ones. One of the coolest examples of this is something called systematic desensitization. It's especially great for phobias. It's a really structured three-step dance. Step 1, you learn deep relaxation techniques, how to calm your body down right then and there. Step 2, you build what's called a hierarchy of fear. You literally make a list of what scares you, from a little bit anxious all the way up to full-blown panic. Then, for step 3, you combine them. You get into that relaxed state and you start at the bottom of your list, slowly, gently exposing yourself to your fears. The whole point is to retrain your brain to associate that thing with relaxation instead of fear.
And there are other tools in this part of the kit too. Relaxation training itself is a powerful skill just for managing day-to-day stress. And then there's something called aversion therapy, which works a bit differently. It aims to create a negative, unpleasant association with the addictive behavior. The goal is to make it seem a lot less appealing over time.
And last, but absolutely not least, we have to talk about the power of people. You know, both anxiety and addiction thrive in isolation. They make you feel like you're the only one going through it. And that's why group therapy is such a game changer. It smashes that isolation by putting you in a room with a supportive network of people who just get it. It's a place for shared stories, for accountability, and for realizing you're not alone.
So, when we put all of this together, it leads us to our final and maybe most important section, a path forward. Because the big message here is one of hope. When you have the right knowledge and the right tools, recovery stops being just an idea and starts becoming a real, achievable reality. So, if you take one thing away from all this, let it be this. It all starts with awareness. Just understanding that this link between anxiety and addiction exists is the first giant leap. And from there, real, lasting recovery comes from finding treatment that doesn't just focus on one or the other, but that tackles both head-on, together. And that brings us to one final thought to leave you with. We talk about recovery as a journey, a process of rebuilding. So the question is, for anyone starting that journey today, what does that very first step, what does it actually look like?